Hello everyone, this is Chadi Alraies from Detroit Medical Center, and this is ARCH 2022. With me is Dr. Jay Mathews. He is the director of the cath lab, as well as PERT and structural heart at Manatee Memorial Hospital. Jay, always nice to see you.
Always nice to see you, my friend.
As an expert in vein, you are an expert in interventional cardiology and peripheral, but lately there was a big attention towards PE, pulmonary embolism, and PERT meeting.
Right.
PERT is consortium. Tell us more about how we cardiologists got involved in that.
Well, you know, it's interesting that, cardiologists seem to have really latched onto the PE space quite a bit too, partly because, obviously we're seeing a lot of these patients. We oftentimes get called, one of the first contacts for a lot of these types of patients when they come through the emergency room. And the whole concept of PERT is to come up with a cohesive algorithm that we can follow, not just from an organizational standpoint, but also from a treatment algorithm standpoint, to be able to get best outcomes for these patients. Because, right now, for a long time, it's been very haphazard with regards to how treatment has been done. There's a lot of differences throughout the country. Some people have a very loose forming program. Other people have a very organized program. Many folks are now part of the PERT consortium as well too, with Dr. Rosenfeld and whatnot too. And the idea is if we can try to get us all together to come up with both a cohesive algorithm so that we can deliver efficient care and also consistent care as well.
Yeah. So it came up in the last few years, but I think during COVID, we have a big surge of cardiologists being involved in COVID and PE.
Yeah, I'm sure you saw this as well too. We certainly saw this in Florida. We had a massive increase in VT events overall, but just thrombus in general. COVID MI, COVID stroke, acute limb ischemia, DVT, and PE. And then even after the acute infections, there's this so-called post-COVID syndrome. Patients who may have had COVID weeks prior, months prior, and they're still more thrombogenic in general. Right. So we're just seeing more events in general, and as a result, a lot more DVT and PE therapies need to be done. These clots are much more organized, so then is the treatment algorithm different for these types of patients? There's a lot of unknowns. Right. So there's a lot of interest from a lot of people who are seeing these patients because maybe their programs don't have a formal process in place on how to treat these patients. Right. When do you treat these patients quickly? When can you delay their therapy? What's the best way to approach these things? And this is all part of these various summits that have been going on recently too. And as you know, there's so many different technologies now to choose from as well too. I think last I heard there's something like 16 new thrombectomy companies that are focusing on the PE space. So it's an exciting time from a technology standpoint. So we're going to have all the technologies, but do we understand what's the best way to treat these patients? Do we understand the disease?
That was about to be my next question.
Yeah.
We are trying to streamline the process.
Right.
Do we have the tools? It looks like we're going to have the tools.
I think we're going to definitely have the tools, but do we understand the disease? And I think the answer is no, because there's so many variables that come into play too. What makes somebody sicker than somebody else? When do we know we're done? Like, how do we know that we've done an effective job when it comes to thrombectomy or thrombolysis or even medical therapy? What are the outcome measures that we need to follow, either intraprocedurally or even afterwards, or even in the pre-assessment?
Absolutely. And how to prevent this happening from again?
Absolutely, because the thing is, though, once these patients, especially some of these patients who've presented with COVID-related VT events, we just find that they're more thrombogenic in general, and they oftentimes have worse outcomes than the traditional PEs that we saw in the past.
Well, Jay, thank you so much for the insight. Please follow Dr. Jay Mathews on the Twitter. He has phenomenal presentations and as well as techniques I learned from as well myself. Watch this video and others on the ARCH YouTube channel. This is Chadi Alraies, and Jay, thanks so much.
Thanks, Chadi. I appreciate it, my friend.